HPV stands for the human papillomavirus. It is a virus with over 200 different strains. Some of these strains are high risk, which means that they can cause cancer. HPV is very common. About 85% of people will have an HPV infection in their lifetime. And there are 13 million new HPV infections in the United States every year. Most of the time, the body's immune system can clear an HPV infection. But when the immune system can't get rid of it on its own, and if it's a high-risk strain of HPV, it can persist in the body for a long period of time and turn normal cells into abnormal cells, and then those cells can become cancer cells. In some cases, those abnormal cells can first turn into pre-cancer cells, and those can be detected through regular screening like Pap testing. And in that case, there are times when those cells can be removed before they develop into cancer, and that's why regular screening is so important. Yes, many people don't realize that HPV can cause 6 different types of cancers that affect both men and women. The 6 different types of cancers are cervical, vaginal, vulvar, anal, penile, and oropharyngeal, which is also sometimes called head and neck or throat cancer. The vaccine is even more effective and provides even more protection against HPV cancers when given before age 13. And it's also more effective when you get the vaccine before exposed to HPV. 3 things. First is that the HPV vaccine is safe, effective, and long-lasting. We know this based on decades of research, clinical trials, and lived experience. Second, the HPV vaccine is cancer prevention. Cancer affects everyone in some way, and if we have a safe and proven option to reduce the risk of even 1, much less 6 cancers, that's amazing. Third, I've had the vaccine myself, and I don't take risks with my own health. Even more, I'm a mother, and nothing is more important to me than the health and safety of my children. Yes, the HPV vaccine is for everyone. There are many reasons, but the most important reasons is that it can also protect against HPV cancers in males. For example, anal cancer, penile cancer, and oropharyngeal cancer, which affects the tongue, the tonsils, and the top part of your throat. And actually, oropharyngeal cancer is currently the most common HPV-related cancer in the United States, and those rates are increasing. And unfortunately, the rates of oropharyngeal cancer in the US are twice as likely in men than women. It can absolutely still be helpful. Even though the response isn't as strong as in younger adolescents, the vaccine will still build HPV immunity. Even if you've already had an infection with HPV, the vaccine can protect you against an infection with a different strain. I recommend that everyone ages 9 through 26 get the full series of the HPV vaccine. And if you're ages 27 to 45, you should definitely talk to your healthcare provider and see if the vaccine could be right for you. It can be difficult to know which sources are credible, especially these days, but I always recommend checking out the American Cancer Society's website. For this topic specifically, I also recommend looking through the resources at St. Jude's HPV Cancer Prevention Program website. And you can always go to the Alabama Department of Public Health site and check out their pages on the Cancer Division and the immunization page.